Hello, I'm Jagannadha Gantic and welcome to another exciting episode of Early Detect Studios podcast. Today, we are honored to have Dr. Prashant Garg with us, the Executive Chair of LV Prasad Eye Institute, a globally recognized leader in eye care with headquarters in India and with a network of over 290 centers worldwide, serving 2 million patients every year. Dr. Garg is an internationally renowned leader in corneal infections, antimicrobial resistance, and eye banking. A recipient of numerous prestigious awards, both national and international, he is on the boards of several international organizations, societies, and scientific journals. Dr. Garg is a consummate clinician scientist with over 190 scientific publications in peer-reviewed journals and has authored several chapters in textbooks. He also holds the Dr. Paul Dubot Chair of Cornea position. Dr. Garg, welcome to the Early Tech Studios and thank you for joining us. It is truly a privilege to have you with us today.
Thanks, Jagannath, and it is my pleasure as well to join you on this podcast.
Dr. Garg, your journey with LV Prasad Eye Institute started in 1996 as a cornea fellow, and today you lead the institute. Could you share with us what inspired you to specialize in ophthalmology, particularly in corneal diseases, and what keeps that passion alive?
It's a very interesting question, and it really takes me back into my childhood. I grew up in a small village in Rajasthan, almost 50 kilometers away from Jaipur. My father was working in an agriculture university, and one of his colleagues organized an eye camp when I was a student of class 5th. I volunteered, and in that capacity, I had an opportunity to watch eye surgery, particularly the cataract surgery. In the later part of my schooling, I was not very keen on joining medicine, but I think this exposure to eye camp stayed with me, uh, possibly at the back of my mind. When I finally decided that I am left with no opportunity but to join medical school, I think during my second MBBS period, my father suffered significant vision loss because of his pituitary adenoma.
Mhm.
And then it became clear to me that working for restoring sight and helping people with vision impairment is going to be my professional goal, ambition, and possibly that is what made me choose ophthalmology. Coming to the point that what made me interested in corneal diseases, um, it was possibly the exposure when I was doing my residency, and we saw several patients suffering with corneal opacity because of very poor eye banking status as well as non-availability of cornea. Many of these patients led a life with permanent vision impairment. So immediately after residency, when I came for the first time to LV Prasad Eye Institute, and I saw so many successful corneal transplant being performed, that became my passion. And I made it a point that given an opportunity, I will like to return back to LV Prasad Eye Institute and serve in this institute. I also
Wonderful.
managed one of my dear friend with corneal ulcer, and that's why I developed passion for corneal infections and chose that as my research area for folk. I think to summarize, I'll say that the experiences in my life have made me choose ophthalmology, corneal diseases, and corneal infection as my professional career or professional journey. And I'm till today remain very excited whenever I handle a patient of corneal opacity or a patient of corneal infection.
Amazing, very inspiring. Thank you for the insight into what led you to ophthalmology. I think your service in ophthalmology and eye domain probably is one of the best things that might have happened to our society in the recent days. So at LV Prasad, what are the major areas of eye health that your team is solving?
So there are on many front um, uh, our colleagues are working. If I have to classify these different or the activities of these different people, I'll summarize them under infectious diseases of eye, both of the front of the eye as well as back of the eye. The genetics aspect of inherited eye diseases, the cell-based therapy, and our group is pioneer in simple limbal stem cell transplant. Uh, in addition, we are also looking and trying to expand the understanding of vision science, particularly what is the impact of vision impairment on the overall neurological and psychological development of young children. We are very active and have a very strong uh, uh, community health program, and we are also looking at what are the problems in community and how do we reach or take eye care closer to the doorsteps of people living in remote rural areas. So the major challenges that are today responsible for needless vision impairment and blindness, uh, on each of those aspects we are actively working.
Amazing. Now, when we talk about vision impairment, the recent report from World Health Organization mentions that 50% of the world's population, that is, every other person, will be myopic by 2050. That is a very serious public health concern and probably a significant threat to our future generations, maybe leading to another pandemic in eye health. So, what are your thoughts on this health crisis and a pandemic in the making?
Yeah, I think in 1997 we conducted a large population-based study. We call that as Andhra Pradesh Eye Disease Study. And that study very clearly showed us that uncorrected refractive error accounts for close to 45% of our vision impairment and almost like 17% of all causes of blindness. So it became clear to us that the uncorrected refractive error uh, is something that uh, uh, we need to focus on and the world need to focus on. Now what we are seeing is that increasingly people are realizing that uh, myopia, which is called as a short-sightedness, is affecting young kids. Uh, the myopia is a disease which has a long-term consequences. Uncorrected myopia can affect the whole psychosocial development of children. If the myopia is more than 6 diopter, then it can also lead to uh, complication in the later part of life, such as retinal detachment, macular degeneration, and the myopes are also at higher risk of developing glaucoma. They also develop cataract at a much early age. So I think the trend that we are seeing particularly if we look at countries in the Eastern Asia, it looks like that this is a pandemic in making. Even in India, our colleague Pawan Varkicharla looked at the data um, over time and also the published literature and clearly identified that from 1999, when the prevalence of myopia was just over 4%, in 2019, the prevalence increased to above 20%.
Wow.
As per his estimates, the prevalence is likely to be about 35% by 2030 and close to about 45 to 50% by year 2050 if we do not take any intervention at this stage. So I think that we have enough evidences that clearly highlights that myopia is an important disease that one should focus on. Now, this is particularly important for two reasons. One, our healthcare delivery system has to gear up to ensure that these children, if they are having uncorrected myopia, are provided with appropriate correction. But secondly, which is even more important, is that if we take certain intervention in young age, we have enough knowledge that we can arrest the progression of myopia or at least prevent these children becoming high myope. So I will definitely consider that uh, ophthalmology fraternity and vision scientists have to work very closely with the local governments um, and create policies and systems that will help uh, us take care of this pandemic.
Yes, absolutely. And I think from a parent's and also from the patient's standpoint, a one simple visit to the clinic probably would arrest and make a difference in their lives, right? So, is that right, Dr. Prashant?
I think what we, based on the experience in China, Singapore, Hong Kong, what we can definitely say that we need to first um, identify children who are at risk of developing myopia. And we can do that. There are enough data available that can guide a clinician to make an inference whether a child coming to them is likely to develop myopia and how rapidly they are likely to progress. Now, our responsibility does not end by just making that diagnosis. Once we make that inference, I think it is also important that we educate both children as well as parents about the lifestyle change that is necessary or that can influence the progression of myopia. For example, in China and Singapore, it is made mandatory that every child should spend close to 2 hours outdoor in the ambient light, and
Mhm.
they should reduce the amount of time they are spending on their gadgets and digital tools. Plus, there are specific devices, the spectacle lenses, contact lenses, and even medical or the drugs that can help arrest or reduce the progression of myopia. So, there is enough research that has gone in to guide us in helping children who are at risk of myopia in uh, arresting the rate of progression or even preventing development of myopia. So I am very sure and I agree with your statement that we the one visit to the doctor should help these children not just in diagnosing myopia which is already developed but also in predicting whether they are at risk of developing myopia.
Wonderful. Uh, Dr. Prashant, while we talk about the research that is ongoing in various fields of eye health, as a premier academic medical center and a top 5 research institutes in the world, LV Prasad plays a critical role in eye care by driving clinical innovation and training the next generation of clinicians. So, in the recent messages, you talked about practicing purposeful research. Could you please enlighten us about the research that the institute is conducting and how is it translating this research outcomes into solving the real world vision problems?
Yeah, this is another very interesting question and close to my heart. I think if you look at a typical research organization, um, what we have realized that the outcome measures of research organization or output of research is measured in terms of number of publications or the impact of publication. I also feel that in a healthcare settings, the focus remains on the social service. How many patients we treat, what new modalities we are using. And there is a gap between what happens in research laboratories versus what we practice in clinical medicine. But if the two groups come together and also identify the problem that they are trying to solve, we will be able to find solutions of many, many problems that we see in as far as diseases are concerned, as far as health issues are concerned. Realizing this, I, in my recent communication, wrote about purposeful research. The objective of that write-up was to stimulate clinicians and scientists to work together on problems that are of relevance to our country and that can make greater impact in the lives of people. For example, we are seeing quite a rapid increase in antimicrobial resistance. And I think we as a healthcare organization has the responsibility of working closely with the basic scientists who are trying to understand the mechanism of antimicrobial resistance or are exploring solutions for. We get these organisms from patients and we can very well share that uh, uh, that resource with basic scientists. In addition, we can deliberate together onto the findings and understand where from or how this resistance is emerging and how we put control on it. There are several such examples where basic scientists and clinicians can work together to address the day-to-day problems of our community and society. Let me give you another example of that. Because consanguineous marriages are common in our part of India, there are a lot of people who are suffering with inherited eye diseases. And this is such a rich pool of patients that we have that we can take help of experts in genetics to not only understand pathobiology of these inherited retinal diseases, but also to look at and explore the possibility of using gene therapy or editing the abnormal gene and provide respite to the patient as well as others, to the family, um, uh, who carries a huge burden of taking care of these children. So by making that appeal of purposeful research, my main focus was to 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 really stimulate my team that they should identify a problem which is important, which is unique to us, and then work very closely with basic scientists working in our organization as well as collaborate with other experts elsewhere in the country or even outside of country, and understand the disease in depth, find solution to the problem, so that 5 or 10 years down the line we are able to provide solutions to those difficult problems.
Wonderful and very well said, Dr. Prashant. All this research will lead to multiple insights and also multiple solutions. And under your leadership, LV Prasad has been at the forefront of innovations in the eye care. Could you also throw some light on few of groundbreaking innovations that you have been part of, and how these innovations are shaping up the future of vision and eye health?
So if we talk about innovations, I think LV Prasad Eye Institute, right from the inception, has uh, uh, made a commitment that we are going to be working on looking at the products that are either not available in our country or are very expensive, and then try to find solution or alternative to these issues. The other thing that I have realized is that in our country, because 60% of the population lives in rural areas away from main or cities, and where the healthcare services are very primitive, we cannot directly translate the advances that are happening in healthcare to our population. We will have to tweak those innovations or create our own innovation pipeline, which will allow these developments and advancement to reach to the wider population, particularly those who are living in remote rural areas. I also see that uh, there is an abundant opportunity for us to innovate different ways of healthcare systems that will allow us to reach out to those populations. So both in terms of creating new product, but also new ways of treatment or management of these issues, and new ways of delivering healthcare are different aspects on which we are focusing our innovation. The pyramidal model of healthcare delivery that came out of our Andhra Pradesh eye disease study is one such product uh, uh, that allows us to ensure healthcare reaches to the remote rural areas. Uh, Healthcare which is appropriate, available, and can be afforded by the community. Similarly, when we started our eye bank, we were not having any intermediate term cornea storage medium. And we decided that we are going to be building our cornea storage medium, which is called as McCarry-Kaufman corneal storage medium. There are other examples of these simple fugal innovations that we have carried out or developed in our network. These range from a very simple folding phoropter that help uh, a common man understand what is the degree of refractive error, if at all they have. Uh, Another is an innovation that allows one to take photograph on the mobile camera. Um, we now also are developing instruments which are going to allow us to carry out tests at the homes of our people and even in remote rural areas,
Amazing.
including field vision assessment, taking images of the back of the eye, assessment of the pupillary function, and thereby knowing about other neurological diseases. There are multiple such examples. One of our colleague, Dr. Prem Nandini, has also developed a visual field analyzer of young babies or non-verbal babies. Keeping in view that now many more clinicians are getting interested in such innovative or such innovations, we also created technology transfer cell in our organization, which is actively tracking all the innovations that are there and facilitating taking these innovations to commercialization and wider use in the community. So currently we have a very well established technology transfer office that is taking care of facilitating uh, uh, clinicians in generating IP, um, creating mechanism for them to start startup or collaborate with other startups, and then um, uh, journey toward commercialization. More recently, we have also started looking at that since we have such a huge data. Uh, we see close to about 2 million outpatient every year, and a wide variety of patient, because being a referral center, we get patients from all over the country. We thought that we should utilize this valuable resource for generating machine learning or artificial intelligence and help clinicians in variety of ways, both for screening of population, making an early diagnosis, and getting a greater insight into the treatment algorithms as well. In that context, we are currently working on a AI-based detection model for myopia as well as for retinopathy of prematurity.
Wonderful. That's amazing to hear the innovations and the research, culminating into the societal good. So you briefly touched upon the technologies, artificial intelligence and machine learning, and all these new technologies. So in your tenure at LV Prasad in the last 3 decades, you have seen multiple transformations in the eye care landscape, specifically the technology adoption. And it cannot be um, ruled out without the new and advanced technologies such as data science, artificial intelligence, machine learning, and it cannot be understated when we talk about innovation. So especially the way healthcare industry is adopting these technologies to create impactful outcomes. So looking forward, probably 5 to 10 years from now, what are your aspirations for LV Prasad and also the global eye care community? Are there any specific areas or projects that you believe need more focus or innovation to address the current and future challenges?
I think I'll start with the basic premise on which we started this discussion. We are living in a country where 60% of the population has little or no access to healthcare. Many of these problems can be dealt by very simple measures. Unfortunately, since the healthcare professionals are not keen on serving in rural areas, many of these patients, whenever they fall sick, resort to going to untrained healthcare workforce, which is very active in these rural areas, or they resort to homemade remedies. And therefore, when they finally reach healthcare, the disease is far advanced and the outcomes are not very good. The best way to use advances that are happening in data science, AI, ML, will be if we can develop simple to use tools that can be in the hands of every human being and that allows them to monitor their health. I think there are huge amount of opportunity that exists today both for industry as well as healthcare professional to create those tools and make them available to every individual irrespective of whether they are living in rural or urban areas. The reach of technology today can be assessed by a simple fact that universal payment system and mobile phones have reached in villages while clinics have and schools have not reached there. So you can understand very well that technology is reaching at a very, very rapid pace into our rural areas. And therefore, if we can take advantage of this scenario and give power of healthcare in the hands of our population, we will be able to transform the overall health of our society. And I am a very strong believer of that. Now, let me bring you to the ophthalmology and the potential of eye examination as for detection of health and health related issues. The eye is one organ that gives you a complete insight of all other structures of the body. We can see blood flow in the retinal vessels. We can see the health of nerves through optic nerve examination as well as nerve fiber layer. Since the nerves are directly connected to brain, we can get also a lot of insight into how, and if we can take a good quality image and from a large pool of data and try to see whether the person is having diabetes, hypertension, renal diseases, all of these problems can be easily picked up by image of the eye. There have been some developments in this area. I'm aware of that Moorfields has developed one such tool that allows even to evaluate and assess the risk of Alzheimer or dementia. So you can understand that we are probably very close to the point where large data will help us create those tools which will empower people in assessing their own health status.
Wonderful. Amazing to see how technology is put to use, Dr. Garg. Dr. Garg, it has been enlightening and truly inspiring to hear your thoughts and stories. Your dedication not just to the eye care, but to nurturing the next generation of eye care providers is commendable. Before we conclude, do you have any message or advice for aspiring ophthalmologists and researchers who look up to you as a role model?
No, it is indeed my pleasure to participate in this podcast, and I think to the next generation of ophthalmologists and researcher, I like to just convey that they are part of a millennium where we are having an interesting combination of problems at one end and lot of hope that technology can provide. If we work together, I am very sure that India, which now has become the most populous country, will provide a lot of opportunities to not only make difference in the lives of people living in India, but also to create models that will be replicated all through the world. I definitely see India as the country of hopes for the next 2 to 3 decades. If we do not use this opportunity, I think we will be missing a big way. So let us all join hands and create models that will help the country as well as other countries and help India to reach a truly a leader in healthcare.
Indeed, we will. Indeed. Very well said, Dr. Garg. Thank you, Dr. Garg, for your insights and inspiration. And for our audience, we come to the conclusion of this episode. Until next time, stay curious. Thank you.
Thank you, Jack.